So, Francesco, it's great that you've been able to produce this abstract about this bladder cancer fellowship program and over a 10-year period. Can you give an insight or short insight into what this abstract is about, please?
Yes, my very big pleasure. This was the project of my research project over the year of my clinical fellowship, because over the clinical fellowship we do have a protected research time, which is really helpful also for the community you're working in and for yourself. This was a retrospective review of the 10 years perioperative outcomes and basically training skills to get independent from the very few first steps in cystectomies up to the skin-to-skin procedure. And what we noticed using the whole sample of the non-muscle and muscle invasive bladder cancer patient undergoing this procedure for a curative intent with intracorporeal islet conduit urinary diversion is that this kind of setting, when it's tutored by experienced mentors and trainees, would offer safe oncological outcomes and extremely safe perioperative outcomes, which are in line with the series published internationally. So first, do not harm, which I think has been a very big success of this training program in the sense of anyway delivering excellent care for bladder cancer patients. From the learning curve stepwise, what we have noticed is that after the 30th case consecutive but done by your mentor, the trainee goes from the learning curve up to the proficiency phase. And that has been measured specifically in reducing drastically the time to the end of the intervention, which is once again a surrogate of how your skills would eventually develop. It's not necessarily a surrogate of the quality of the surgery, but definitely mirrors how the fellow would get more confident with the clinical modular and eventually independent. What I think is strikingly in terms of data is that almost 60% of the fellows by the end of the 4th month might be able almost to complete a skin-to-skin cystectomy with intracorporeal diversion, and how the 98%, all of them, by the end of the program would eventually have joined a complete case, completely autonomous, just supervised, without the need or the intervention of the mentor. So this is, I think, is the benefit of the clinical modular application that we have been seeing also published by the EARS, which is the same philosophy that's been there at GUISE since ever, and is really beneficial on any kind of spectrum and international profile of fellow apply. So these results are probably not generable and possibly applying to everywhere. You need to have the infrastructure. You need to have a dedicated fellowship training program, so the outcomes we are deploying in this conversation might not be the same in other programs and settings. So this is something that we need to be aware. But this is, once again, probably the only way we can safely approach training in radical cystectomy, which is not only skills on the technical part, but it's also the whole perioperative care, where, of course, I probably will be still calling you overnight for my cystectomy cases. But this is it.
Brilliant.
Thank you. Thank you very much.